Hello and welcome back to a new school year. You are viewing the School-Based Healthcare Services Program Annual Training for SBHS Medicaid Coordinators. This training is intended for school districts who are contracted with the SBHS program and specifically for the school staff who is the point person for managing the district's SBHS Medicaid program. This person is also known as the SBHS Medicaid Coordinator. Please note that this training is intended to provide information and program updates, but does not supersede information found in the SBHS Program Billing Guide, SBHS WAC, or the SBHS contract. If you are a new SBHS coordinator, or if your district is not currently participating in the SBHS program, it is recommended that in addition to viewing this training, you also view the SBHS 101 training. The SBHS 101 training provides an in-depth look at the SBHS program. New SBHS coordinators will also want to download and review the checklist for new SBHS coordinators. School districts who are not currently contracted with the SBHS program can download the checklist for new school districts for more information on how to become contracted. The SBHS 101 training, the checklists, and a PDF of today's training can be found on the SBHS webpage at www.hca.wa.gov/SBHS. On today's training, we will take a look at a few program updates, and we will also review some reminders for the upcoming school year. On the last few slides of today's presentation, viewers can find SBHS program resources and contact information. On these next few slides, we will take a look at some SBHS program updates. Both the SBHS Program Billing Guide and the SBHS Fee Schedule were updated recently. Important changes to the billing guide include the removal of the signature log and some major telemedicine changes. We will go over these changes in more detail on the next few slides. This is a reminder that the SBHS Billing Guide is your one-stop shop for all things related to the SBHS program. It contains all relevant program policies and procedures, as well as HCA contact information, billable codes, documentation requirements, answers to frequently asked questions, etc. The SBHS Billing Guide is a useful manual for both SBHS Medicaid coordinators as well as school providers. As the SBHS Medicaid coordinator for your district, it is your role to ensure that providers and other school staff have access to the updated billing guides so that they are aware of any program changes. The SBHS fee schedule was also recently updated. No new codes were added to the fee schedule, but rates for most codes have changed. HCA updates the SBHS fee schedule annually each July as the national codes and rates are updated by the Federal Centers for Medicare and Medicaid Services. If you are a self-billing district, you will want to ensure you are using the most current fee schedule as you will need to enter the rate of each code on your claims. A link to both the billing guide and the fee schedule can be found on the SBHS webpage. As mentioned on the previous slide, one of the changes you will notice in the billing guide is that the Healthcare Authority no longer requires school districts to maintain a signature log of each provider's signature. Any previous logs must be maintained for 6 years. Logs may be scanned and stored electronically. Although the signature log requirement is going away, providers must still authenticate their treatment notes and service logs by using either an electronic or handwritten signature per the SBHS billing guide. Please note that although the signature log is no longer required, districts are still required to maintain a list of all providers participating in the SBHS program on the Provider and Contact Update form. We will take a look at what is required on the Provider and Contact Update form during the Reminders section of this training. On these next few slides, we will take a look at some telemedicine changes that will impact the SBHS program. The SBHS program has allowed services to be provided through HIPAA-compliant audiovisual telemedicine since 2015. During the COVID-19 emergency, the Healthcare Authority allowed many flexibilities on telehealth service delivery, including audio-only service delivery and non-HIPAA compliant audiovisual platforms. Previously, all codes in the SBHS program billing guide were reimbursable when provided through HIPAA-compliant audiovisual telemedicine platforms. Effective October 1st, 2023, HCA is now limiting which codes can be billed via audiovisual and audio-only telemedicine platforms. Now that the public health emergency has ended, the Healthcare Authority will be limiting which codes are reimbursable when provided via both HIPAA-compliant audiovisual and audio-only telemedicine platforms. HCA has made these decisions based on which services can be safely and effectively provided through telemedicine. Effective October 1st, 2023, only certain services are reimbursable when provided through HIPAA-compliant audiovisual and audio-only telemedicine platforms as outlined in the SBHS program billing guide. A column has been added to the coverage tables in the billing guide to indicate whether a service is reimbursable when provided through telemedicine. The documentation requirements for telemedicine service delivery have not changed. When providing services through telemedicine, providers must document services the same way as if they were providing services in person per the SBHS billing guide. In addition, providers must document that services were provided through telemedicine and must document whether the platform used was audio-visual or audio-only. Providers must also make note of the location of the student and the location of the provider. If your school district self-bills, you will need to make sure your providers are aware of these changes so that they can accurately document their services. If you are a self-billing district and you use a district-wide treatment note template, you will need to make sure the template includes these fields if the providers often provide services through telemedicine. If your district contracts with a billing agent, the electronic documentation system provided by the billing agent may have drop-down menus or specific fields to indicate telemedicine service delivery. Any questions on how to document telemedicine service delivery when using EasyTrack, Whammer, Embrace DS, or DSC Top should be directed to the district's billing agent. Telemedicine facility fee. There have been no changes around when providers can bill for the telemedicine facility fee, code Q3014. The telemedicine fee is submitted on a separate claim using place of service 03. Providers can bill for the telemedicine facility fee when the student is located at the school, the provider is located in another location, and only when services are provided through HIPAA-compliant audiovisual telemedicine platforms. Please note that the telemedicine facility fee is not billable when services are provided through audio-only telemedicine, even if the student is located at the school. On these next few slides, we will take a look at some upcoming changes related to how school district staff access the Provider One system. Instead of logging directly into Provider One as you do today, the Healthcare Authority now requires district staff to access the district's Provider One account through the One Health Port online portal. Current Provider One system administrators were notified of this change in November and December 2022. HCA's SBHS program manager also sent numerous GovDelivery emails to districts with additional information about this change and provided One Health Port registration information. So what exactly is One Health Port? There's been a lot of confusion about what One Health Port is and what it does. One Health Port, or OHP, is a secure online portal where SBHS Medicaid coordinators and other district staff, such as business managers, accounting staff, special education directors, etc., will access their district's Provider One account. Please note, One Health Port is not replacing Provider One. School districts who participate in the SBHS program are still required to have a Provider One account. The only thing that is changing is how district staff access their Provider One account and how the SBHS Medicaid coordinator will add additional super users. Currently, districts can still access their Provider One account by logging directly into the Provider One system. However, districts must register with One HealthPort as soon as possible in order to avoid disruption to Medicaid billing. As of today, approximately 40% of SBHS participating school districts have registered with One HealthPort. This means that more than half of all participating districts still need to register. Within the next few months, HCA's SBHS program manager will email those districts who have not yet registered and will be available to provide technical assistance as needed. After a district registers with One HealthPort, the district receives login credentials from One HealthPort. District staff who need access to Provider One will then visit the OHP portal and will use their OHP credentials to access the district's Provider One account. Once logged into Provider One, staff will navigate Provider One as they do today, such as to enroll providers, view claims, or view payments. It is recommended you access Provider One frequently to avoid losing access. Login credentials may deactivate after 180 days of inactivity. Please note that school providers, such as occupational therapists, physical therapists, speech-language pathologists, nurses, etc., do not need to register with One HealthPort as they do not need access to the One HealthPort system or Provider One. The only staff who will need access to Provider One, aka One HealthPort, is the district's SBHS Medicaid coordinator and other district staff such as the business manager or accounting staff. Once the district registers with One HealthPort and assigns login information to relevant school-based staff, the school staff, such as the SBHS Medicaid coordinator, logs in to One HealthPort to access Provider One and then enrolls providers the way they do currently. On this slide, districts can find the One HealthPort registration guide, as well as contact information for One HealthPort. The SBHS program also created an FAQ to assist districts with registering and other frequently asked questions about this process. On these next few slides, we will take a look at reminders for the upcoming school year. One of the most common questions I receive from school districts is which providers are eligible to participate in the SBHS program. A list of eligible providers can be found in WAC 182-537-0350, as well as in the SBHS Program Billing Guide. In order to participate in the SBHS program, providers must hold licensure with the Washington State Department of Health, and they must have a National Provider Identifier. Any provider the district plans to bill for must be enrolled as a servicing provider under the district's Provider One account. Non-licensed school staff, such as paraeducators, school psychologists, school counselors, health aides, etc., are allowed to participate in the SBHS program as long as they are practicing under the direction of a Department of Health licensed provider within their scope of practice. More information about supervision requirements, how to bill for services provided by non-licensed staff, and a list of all SBHS eligible provider types can be found in the SBHS Program Billing Guide. In order to ensure provider information is up to date, and in order to ensure HCA has updated information for each school district, SBHS Medicaid coordinators are responsible for updating the provider and contact update form annually and throughout the school year as new providers come on board, as providers resign, and as school district contact information changes. At the beginning of each school year, SBHS coordinators must email an updated form to HCA's SBHS program manager with a CC to the district's billing agent, if applicable, by October 31st. SBHS coordinators should be working off of the same form year to year, and an updated form is required each school year, even if nothing has changed. If nothing has changed from last school year, the SBHS coordinator can simply update the school year and date field on the contact page and email to the SBHS program manager. If the SBHS coordinator is not able to complete the form by October 31st, they may send an email to HCA's SBHS program manager in order to request an extension. Please note that directions on how to complete the form can be found on the Contact Instructions page and the Provider Instructions page at the bottom of the form. After the SBHS coordinator has updated the district's provider and contact update form, the next step is to enroll any new licensed providers in Provider 1. When enrolling new providers under the district's Provider 1 account, SBHS coordinators should enter September 1st of the current school year as the enrollment effective date. This allows the district to retro bill for any services provided while the district waits for the provider application to be approved. After submitting the provider's application in Provider 1, it can sometimes take up to 12 weeks for HCA's Office of Provider Enrollment to approve new provider applications. Districts can track a provider's application status by clicking on the Track Application button in Provider 1. If your district contracts with an outside billing agent, such as Leader Services, PCG, Embrace IEP, etc., SBHS coordinators will also need to enroll new providers in the billing agent's documentation software system. Please contact your billing agent for more information. While adding new providers to the district's Provider 1 account, the district's SBHS coordinator should also take a look at the district's information in Provider 1 to ensure everything is up to date and accurate. If the district does not have any new providers to enroll, the district's SBHS coordinator should still review the information for the district as outlined on this slide. It is recommended that the district's SBHS coordinator review and update the district's information annually at the start of each school year. Under Step 1, Basic Information, the coordinator should confirm that the federal ID and email address on file is correct. The email address listed under Basic Information should be the SBHS coordinator's email address. HCA's Office of Provider Enrollment will use this email address if they have any questions about changes submitted on the account. Under Step 2, Locations, the coordinator should confirm the district's address is correct. Under Step 4, Ownership and Managing Controlling Interest Details, the coordinator should confirm the managing employee listed is up to date. Under Step 9, Federal Tax Details, the coordinator should confirm the district's federal tax ID information is correct. And under Step 15, the coordinator should confirm the district's bank account information is correct. This ensures SBHS Medicaid payments get to the district on a timely basis. And finally, if the district's coordinator makes any changes to the account, they must be sure to click Submit Modification for review. Another piece of information that the SBHS coordinator should review annually is the district's information on the NPI registry. Specifically, the district's SBHS coordinator should ensure the authorized official information is accurate, as well as the district's physical and mailing addresses. Any updates needed to the district's information can be made on the NPPES website. This is a reminder that for services provided after July 1st, 2022, school districts no longer receive an invoice showing the breakdown of the claims, and districts no longer need to submit local match to HCA. Services provided after July 1st, 2022 automatically pay within a week after being entered into the Provider 1 system. During the 2022-23 school year, this process was a little confusing as many districts were still submitting claims from the previous school year. This meant that HCA was invoicing districts for some services and other services were automatically paying. This made it difficult for district staff to track and report their Medicaid reimbursements. During this upcoming school year, districts should find the claims payment process to be much smoother due to the fact that districts should be all caught up with submitting old claims, and any new claims entered will automatically pay or deny. This means that it will be much easier to track payments through the remittance advices, which we will take a look at on the next few slides. As mentioned on the previous slide, district SBHS coordinators and other school staff who have access to the district's Provider 1 account can track SBHS payments through the remittance advices. Typically, claims pay on a Thursday, and the RA for that payment is available on Provider 1 the following day on Friday. The remittance advice provides a detailed list of paid, denied, and adjusted claims. To access the RAs, district staff log into Provider 1 and click on View Payment on the left-hand side of the screen. A list of the district's RAs for the past 4 years will display. District staff can click on the RA number in the first column to open the RA. Once the file is open, it can be saved as a PDF file. District SBHS coordinators can download the RAs and share with district accounts payable staff, or the SBHS coordinator can add other school staff as users in Provider 1 so that they can access the RAs. Reading the remittance advice training provides step-by-step directions on how to access and read the remittance advices in Provider 1. On this next slide, we're going to review the Medicaid revalidation process. If you have been the SBHS coordinator for your district for a while, you may have gone through the Medicaid revalidation process at one point or another. Medicaid providers, including school districts who participate in the SBHS program, are required per federal and state regulations to complete Medicaid revalidation every 5 years. When a district is due for revalidation, HCA's Office of Provider Enrollment mails a letter to the district's business office with instructions. The SBHS program manager typically sends a follow-up email to the district's SBHS coordinator and business office with additional directions on how to complete the revalidation. In Washington State, Medicaid revalidation for school districts includes providing a new core provider agreement, a debarment statement, a trading partner agreement, and an updated W-9. In addition, school districts must also ensure information in Provider 1 is correct and up to date, including the district's address and contact information, as well as the managing employee information. More information about the revalidation process and what is required can be found in the SBHS Billing Guide. SBHS notifications. This is a reminder that all SBHS program updates and program news are sent via GovDelivery email notification. To ensure the district and providers are compliant with SBHS policies and procedures, at least one school district staff, typically the SBHS coordinator, is required to sign up to receive the SBHS notifications. One of the roles of the SBHS coordinator is to relay important SBHS messages to other district staff and/or providers. Other district staff, such as the special education director, the superintendent, business manager, and/or providers, are also encouraged to sign up to receive SBHS notifications as well. Resources. On the next few slides, we will be taking a look at some helpful resources which are available to SBHS coordinators and providers. To ensure school districts are successful managing their SBHS program, and to ensure both providers and SBHS coordinators understand Medicaid billing procedures and requirements, the SBHS program has created many resources which are available on HCA's SBHS webpage. Resources available on the webpage include the annual checklist for SBHS Medicaid coordinators, trainings and resources for coordinators and providers, links to the SBHS program billing guide and fee schedule, as well as past program notifications and more. Be sure to bookmark this link today. As mentioned on the previous slide, the SBHS webpage contains many resources for districts' SBHS Medicaid coordinators. In addition, the webpage contains many resources for providers as well. SBHS coordinators should ensure they share these resources, including the provider-specific trainings with new providers coming on board, or for those returning providers who may need a refresher course on what is required for Medicaid billing. Please note that the provider trainings have been updated recently to reflect the new telemedicine changes. Although HCA's SBHS program manager is the main contact for the SBHS program, and most questions can be directed to the program manager, SBHS coordinators will find on this slide a list of other useful HCA contacts, as well as contact information for billing agents and one health report. And that concludes the annual training for SBHS coordinators. Any questions about today's training may be directed to the SBHS program manager. Thank you, and I hope you all have a great school year.